I'm Angela Mark. I am a tribally focused project officer in the Suicide Prevention Branch Center for Mental Health Services at SAMHSA. And I'm just going to kind of go through the slides, so maybe there'll be time if you have any questions for me, at the end. Let me see how I'm gonna. Oh, there we go. Okay. The slide takes up. It looks a little strange on my side. Oops. Okay. I'll figure this out. So here are the programs that are housed within the Suicide Prevention Branch at SAMHSA, and I'll just quickly kind of go over each one of these. And although they're not specifically for Native American, Alaska Native, those communities and tribal entities are eligible to apply. The first program is the Garrett Lee Smith State and Tribal Youth Suicide Prevention and Early Intervention Program. This is for youth ages 18 to 24, focusing on suicide prevention activities and early intervention strategies. There are requirements, lots of different requirements of this program. Some of the main ones are that they must include collaboration among youth-serving institutions and agencies. That includes schools, juvenile justice systems, educational systems, foster care, substance abuse, mental health programs. And they must include a strong community component as well as a strong health system component. And the ultimate goal of the program is to reduce suicide deaths and non-fatal suicide attempts. There is a national evaluation that has been conducted quite extensively for this program. And with some of the results of that over the past couple of years, we've really heightened our efforts around care transitions and follow-up. And it does tend to be more of a data-driven grant. Let me see here. Okay. Let's see. Okay. It's what's throwing me off is that the whole slide doesn't fit on one page. It's like I don't know what you can see on your side, but it'll be fine. I'll make do. So these are pretty hefty grants, $3.7 million over 5 years, and as of last year, 2016, we've awarded this grant to 50 different tribal entities, 14 of which were Alaskan. The next is the National Suicide Prevention Lifeline, which is also housed in Suicide Prevention Branch here at SAMHSA, and this is a the National Suicide Prevention Lifeline, 1-800-273-TALK. It is comprised of 160 accredited crisis centers across the country that people can call when they're in emotional distress or suicidal, or even if you need resources. It's 24/7. It does average 120 calls per month. And, oh wow. Okay, go back. And I did put a few at the bottom here. There is one that is in Fairbanks, Alaska, and I just put a few numbers here from March of this year from January to March of this year. There were 1,061 calls were initiated and 685 were answered. And so the calls that weren't answered in Fairbanks do get rolled over into the lower 48 crisis centers. Going the wrong way. Okay. Suicide Prevention Resource Center. So this is also housed in the Suicide Prevention Branch. This is the nation's first and only federally funded Suicide Prevention Resource Center. And there is a website that I put at the bottom, sprc.org, and it's for anyone can go in and get all kinds of resources. There's fact sheets. There's lots of stories of community-driven grassroots efforts that have been very successful in communities, surveillance success stories. So this is also available to anyone. Tribal Behavioral Health Program, Native Connections. I might talk a little bit more about this program because this is my main focus currently. This program is geared towards tribal entities only. It is for youth up to and including age 24. The focus is suicide prevention, substance misuse, and overall mental wellness. This program started in 2014, and we are now going to be awarding our third cohort this August of this year, and we're working with 90 communities right now. 20 of the communities are Alaskan, and even though I say 20 are Alaskan, really some of those communities are working with other small communities around them, so it's probably a little closer to 30. This is a little bit of a smaller grant since it is geared towards communities that have no infrastructure, maybe have never received a grant before. And let's see, okay. Just briefly what the program looks like, and I do talk about it because I think it's a little unlike other federal government programs out there. We do spend the first year really getting to understand the community. We ask about views in the community on suicide and drug misuse. We try to understand the council. What are the holidays in your community? What are your cultural traditions? What do you celebrate? What are maybe some of the challenges? We're pairing you up with someone that is in your region of the same size, so that when you do get awarded something like this, a lot of folks say, oh my gosh, I'm out here and I feel like this weight is on my shoulders. So we like to pair them up with someone to talk to, and I am also in contact with all of the communities that I'm working with monthly or bi-monthly. So we're in constant communication. This program's built in community readiness, so that is conducted in the first year, along with the community systems analysis, followed by strategic action planning. And then another requirement is you must have crisis and follow-up protocols developed. And then based off of the community readiness and the strategic action plan, that sort of guides years 2 through 5. Community systems analysis is really just a snapshot of the infrastructure in the community. And so sometimes a community might think that they don't really have a lot of, folks or resources that they can pull upon. So we have a pretty extensive template that we help them along with. And we don't ask them, you have to fill out this template, because we have a lot of good stuff, but we like to do what's more beneficial to the community. So if they have other ways of doing it, what's important is that it's all community driven, and that they're going to that this program is going to be beneficial for them. So let's see. So just these are 8 categories that we talk about for the community systems analysis that we ask them to complete, so that they can kind of visually see what and I got permission from this one community in Alaska to use. So these things really do take over the course of a year to think through. We also have TA that works quite extensively with them. TA, that is actually the folks are in Alaska. And then just a visual of the community systems analysis. The graph right here shows, that they have a lot of strengths in the community. So we really like to focus on strengths. But then we can see that maybe there's some gaps when it comes to tribal best practices, and maybe they could call on spiritual advisors or folks, the elders in the community. So it kind of gives us a good visual to go off of. Community readiness, I won't go through this too much, but we do quite extensive community readiness. We do ask for a minimum of so many folks in the community, wide variety to be interviewed. Things that are kind of coming out of this are a lot of the we have a way that we do community readiness, a way that we do scoring, dimensional scoring, but some of the things like we're altering a little bit, like some of the folks in Alaska are saying, hey, we like to do things in groups, we like to do things in pairs. So we're like, that's fine. If you want to do community readiness, be interviewed in a pair, that's fine. So there's like, you know, things as we go along that we're learning and changing to fit the needs of each community. And then I won't go through this too much. This is just the stages of readiness and the dimensional scoring that is conducted. And so after we have, let's see. So after we do the dimensional scoring of the community readiness, that really leads us into the strategic action planning, which also includes some of the strengths and maybe some gaps we need to fill in the strategic action plan. So we take the 2 lowest dimensional scoring of the community readiness and we make those priority in the strategic action plan. And we also talk about some of the folks that are running this program in the community. Maybe they're at a higher stage of community readiness and they maybe need to wait a little bit. You know, they get a little anxious, you know, because the rest of the community hasn't caught up with them yet. So these are all things that we do talk about. Developing crisis response plans.
Angela, sorry, just to interrupt. Can you go back for a sec?
Oh, sure.
The last 2 examples of your strategic plan for this community, decreasing substance use and increasing family bonding, strengthening families, it's actually very consistent with some of the outcomes from Rising Sun. So we'd certainly like to sort of continue engagement with you and your programs in some way to incorporate that toolkit online when it's available and our outcomes into some of these strategic planning going forward.
Yeah, for sure. I think that incorporating the families was something that we were always kind of lacking on, and we still haven't really quite figured it out yet. Although I have pages and pages of lessons learned and things that as funding opportunity announcements, you know, we try to better them each time as we're learning from communities. But yeah, thanks for saying that, Roberto. And then developing crisis plan and protocols. So communities are to develop this because we know in times of need, it's not always easy to remember all of the resources that are available in your community. So we ask that this be done for suicide attempts, traumatic deaths in the community, suicide clusters. We want to know what does the follow-up look like, not only for the individual, not only for the family, but for the community as well. You know, and what does that look like long-term? And who are the first responders in the community? So this is another thing that I'm sort of learning from, is that I've received a couple really fancy 20-page crisis response plans. And then unfortunately, a suicide happened in the community, and I said, did you follow this plan? And they said, no, we went to the behavioral health aide in the community. And I said, well, that doesn't do the community any good. Don't, you know, there is no need to be doing busy work because the federal government project officer asked for it. So we're always sort of like talking about these things, you know, making sure that it's only to benefit the community. It's not to benefit me. Let's see. So for this program, we do not necessarily have a national evaluation quite yet. We call it more evaluability assessments, and we do collect on certain indicators. So the things that we're looking for are, have you made any new policies in your community? Any new collaborations, contacts? Do you have any newly implemented services? What is the number of youth that have received follow-up care from the number of youth that you have referred, and follow them through the system that you have, you know, making sure that no youth has fallen through the cracks. Number of substance-related ER visits, underage drinking, and have you reduced suicides and attempts in your community? And just a note on this, another thing with the evaluability assessments is lots of communities don't really have any data at all. They're starting from zero. And so we do have ICF, who is working with the communities on this, on building infrastructure, whether it's you're starting out with a spreadsheet of some sort, or, you know, and what does that look like, and how, you know, it's not for us, it's how is your community, you know, how is the data going to benefit you? And so we're teaching, you know, all of that, because the first thing that they hear is data, you know, why do you want data? And so we talk a lot about that too. Something else that is housed within Center for Mental Health Services is the SAMHSA Tribal Training and Technical Assistance Center. And this is really available to any federally recognized tribal entity. Lots of folks use this. You can be a recipient of any of our grants or not have any grants through SAMHSA. This can be accessed through the SAMHSA website. And a lot of times, communities tend to use this more for there's been an unfortunate tragic death in the community, maybe several, and they ask that we do GONES, Gathering of Alaska Natives, or Gathering of Native Americans, GONAs, and sort of more healing work. So you know, we get requests for all different things, but definitely lots of GONES and GONAs. And I won't talk too much about this, but it's a new grant program, Zero Suicide. We have a $2 million set aside for tribal organizations and entities. And this is really embedding zero suicide into your health and behavioral health care system. It is geared maybe towards folks that have somewhat of an infrastructure in place. And let's see my next slide. It's a 5-year program. And then this is the zero suicide model. It's done through several stages that the recipient will, or the grantee will go through. I won't go into it too much. And okay, and then the SAMHSA store is something that anyone can access through the SAMHSA website. There's just a few of our publications. You can have them shipped anywhere, any amount, and they're all, for the most part, I believe they're all free, so that's good. So a lot of the communities will use this, or I'll send stuff out to the communities. And that's it. Thank you.
Thank you very much, Angela. Are there any questions for Angela? Again, all the slides for the presentation are available on the website for download. And
could you back up one slide, Angela? I just wanted to get that website. Is it a .gov?
Is that for
store? Yeah, it's .gov.
Oh yeah.
Okay, thanks.
You're welcome.
And Angela, are you based in DC?
Yes.
Thanks for the nice overview.
You're welcome.
Anyone else? Are we doing on time?
I want to also say that was a really nice overview of information that I wasn't familiar with at all. And maybe Roberto can show you how you can load some information onto the IARPC Collaboration's website that can get shared more broadly about some of these grants and some of these possibilities for people to get involved in the community. Because I think we could get this out to communities in other ways that maybe you're not reaching.
Sure, I think that's great. This is the first time, I know I'm new to the work group, and so I was navigating through your website, the ARPIC website, and I'm just amazed at the resources. So I'm definitely will start sharing information through the website too.
Yeah, thank you, Angela. In the past, I think I've sort of forwarded a few things that come across. You know, I think I put the Native Connections on there before, but
yeah.
You know, I definitely am missing probably a lot of things that you're more familiar with from SAMHSA directly. So it would be great if you can be able to take an initiative and sort of in posting some additional announcements and achievements.
Sure. Yep, because I believe the zero suicide is on the street now, so
Okay.
that might be something I'll post today for sure. I'm
Right.
just
I think
trying to,
NIH is beginning to also look at new notices for leveraging the zero suicide grants from SAMHSA as well. So yeah, there's a lot of sort of collaboration there. So
I saw that.
yeah.